Okay, so hello everyone. Welcome to this masterclass sessions on pharmacy practice. This is Dr.Sourabh Kosey, Professor and Head Department of Pharmacy Practice, ISF College of Pharmacy. I would like to welcome you all on the occasion of lecture number 17, that is on medication history interview. So I'm sincerely acknowledging the collaborators and the motivators, respected Shri Parvinder Ji, Chairman ISF College of Pharmacy, Engineer Janesh Garji, Chairman TLF School and Secretary ISF College of Pharmacy, Professor G.D. Gupta, Director and Principal ISF College of Pharmacy, Professor R.K. Naran, Principal ISF College of Pharmacy and Research, and Dr. Abhishek Pujakumar, PharmD 4th year, all the HODs, the students, and dear participants. Welcome you all once again. And this is what we did this week. We have started with a very extravaganza in the patient safety celebrated worldwide. So third week of September, we have started this 5th National Pharmacovigilance Week, where we are looking after from various segments from medicals, clinical research organizations, pharmacovigilance firms and hospitals. And in this, it's a kick start, and the speakers are from the medical fraternity, from the academia, from the clinical research, from the drug safety associate units. And in the inaugural, we had chief guest Professor Y.K. Gupta, President AIMS Bhopal and Jammu, as well as Principal Scientific Advisor PVPI. And these are some glimpses of yesterday inaugural ceremony, where Professor Y.K. Gupta sir inaugurated this and gave blessings and all the concerns regarding the pharmacovigilance. So I would request all of you to register into it, and from tomorrow onwards we are having the bunch of sessions on drug safety. So our first speaker is Dr. Vikas Medi from PGI, Cami Goyal sir from Safety Aggregate Report Manager IQVIA, Anup Kumar sir from DIPSA, MP Arora madam from CMC Ludhiana, Deepika Bansal ma'am from Naipar Mohali, Rakesh Dixit sir from KGMU Lucknow, and Dr. Ajay Prakash also from PGI, additional professor. So we are doing over here the patient interview, and in this particular segment, in this lecture number 17 of Masterclass, we are doing this patient medication. And in this section, we need to understand that interviewing a patient is looking for his or her medical history. So what is the requirement? We come to know with the patient, understanding about illness, disease, what patient require from us, what as a pharmacist you are supposed to tell to the patient, medication administration, and many more aspects of patient care. So you have data regarding food, data regarding medicine, socio-demographic status, personal information, social history, family history, past medication history, past medical history, vaccination history, adherence habits to the medicines, known safety concerns, allergies, etc. So for conducting medication history interviews, there is a form every quality department in the clinical pharmacy unit in the hospital. This form is particularly made up to record the history, where the demographics, past medical history, past medication history, prescription drugs, non-prescription drugs, and substance abuse, family history, psychosocial history, any dependence on any social drugs, etc. are covered. So this is a very wonderful kind of form where we can understand the patient and tell the patient about various means of knowledge. So this is one of the foremost concern in the patient concern. So patient medication history interview not only tells about the status of the patient, but patient's habits, patient's do's and don'ts with the medications, with foods, any kind of substance abuse if the history is there, or anything which leads to a contradiction. So in this concerns, we have to look for the patient medication history interview. So while going to the patient medication history interview, we check out the vital data, general examination, and systemic examination. In the vital data, all the personal history like name, age, sex, occupation, race, religion, and marital status, income, and occupation, how many number of issues, children's, individual having, likewise things are particularly asked and think about. Then comes up is the general history where the chief complaints on admission, past medical history, medication history, family history, social history, and certainly the things are asked in a manner where from we can get the data from the patient in a manner which is beneficial and helpful in concern with this part. So this is the portion where you do the review of system of the patient. You do a concern related to the economics, either the patient is able to afford the therapy or not, and many more interventions you used to do. So this concentrated level where the persons are more compiled with the history, we are knowing with the more about the patient. So in that context, onset of action, duration of action of any disease previous, of any drug, previously consuming drugs, any elevating factor, comorbid conditions, if any pain, if any radiation or any kind of therapy which have been went through, we have to check out this in particular. Then general examination. In general examination section, you have to see, you have to check out what kind of work is exactly seen with the patient. So patient consciousness, place, person to time, all the 5 sensory organs are working or not in a proper manner, and certainly also many more things where we can understand that the patient's perception is everything. So patient individually might be telling some good things in particular. So in this prospects we see. So if we take history in a proper manner, some clues or hints will be coming. Then several equipments like a stethoscope and particularly sphygmomanometer, thermometer, torch, wooden tongue depressor, measuring taps, etc. on an examination table. In the examination environment, head should be washed, proper light should be there, and a co-person when examining a female patient, if you are a male medic, proper exposure, correct position of doctor and patient. Ideally, the examiner should be on the right side of the patient. Hands are washed. Then in the general examination, general appearance, hands, arms, skins, face, eyes, mouth, neck, edema, lymph nodes, vital signs, temperature, pulses, respiration, pulse rate, pulse oximetry. General appearance, gait, height, weight, BMI, obese, tall, muscular, asthenic, cachic. State of awareness, place, person, time. Facial feature, expression, mood, attitude. Speech, position, personal hygiene, breath order. So basic clinical skills, 70% of the diagnosis can be made based on history alone, and the 90% of the diagnosis can be made when the physical examination is added. And furthermore, the tests are done. So examination of the patient, we need to see the decent manner, kind attitude, highly responsible thing with good medical morals and elegant appearance. The hand should be warm, permission and politeness must be there. Stop at any time patient is uncomfortable. Preparation of the examination room, well quiet and under respect privacy, position patient at 40, patient are always examined from the right side of the bed. Oscillation is means to listen. So stethoscope is used so in blood pressure condition or listening the sound. So oscillation is one process while using stethoscope. Safety precautions while isolation, disbursing, as used in exposed medicines. Then the position of the patient is very important thing. Sitting, supine or dorsal, or if you are preparing the patient for the examination, lithotomy flower or prone position should be taken up, or in various conditions like SIMS, protologic, knee, chest, various examination conditions as per the medical condition is suggested. So in general examination, patient is asked to have the vital signs monitoring, gait, and all the consciousness level is being observed by the examiner, and whereas written for the OPD or IPD based on the disease illness. In the general examination, acromegaly is also checked where any thyrotoxic goiter or change into the facial size, etc., and clinical features manifestations of the history and the future research. What are the various rules for examination? It's very important to understand the cause, etiology of the disease and various mechanisms associated with. So while doing the history, look the inspect, palp, percue, osculate. So like palpation is the feeling, means if you are taking the pulses of the body, so you will do palpation. Looking, like if I say the color of the eyes is changed, bilirubin level if it's increased for the tetanus or jaundice, so you can evident that color. Then tapping is percussing. The example for tapping is edema. Okay, and for listening, oscillation already mentioned, hypertension. So systolic and the dystolic and cardiovascular sounds is being researched. So medicine is learned by bedside, not in the classroom, as said by the Sir William Osler. So for that purpose, we have to go with the patient. And the four cardinal principles of physical examination is inspection, palpation, percussion, and osculation. So teach the eye to see, the finger to feel, and ear to hear. What is the fifth? Smell. So your fifth sense also works. So important is right hand side of the patient on the examination table or bed. You should be there. And there are 12 organ systems, so review of organ system should be sequential and proper exposure. Important aspect of physical examination, right hand side of the bed and examine with one hand. And important aspect of physical examination, the examiner should continue speaking to the patient. You should make the patient very vocal, show interest, show care, show pharmaceutical care, evidence-based medicine concept. Do proper counseling, proper exposure regarding the questions which are necessary for the inspection. For an example, when examining a woman's breast, it is necessary to check for any asymmetry by inspecting both breasts at the same time. So nowadays the mammography vans are available for this purpose. And after the inspection has been completed, the physician may use the patient gown to cover the breast not being examined. So the privacy belongs. How to do the inspection? Make sure the room is comfortable with the temperature, good lighting, preferably sunlight. Look and observe before touching. Completely expose the body part you are inspecting while draping the breast. Compare symmetrical body parts. Precaution to take. Open-minded, particularly you should be there while doing the examination. And into this case, when handling blood soiled or body fluid soiled sheets or clothing, gloves should be worn when examining any individual with exudative lesions or weeping. And this is how the clubbing is checked. Clubbing is one thing where 180-degree or 160-degree of the nail. Mental status and personal grooming, how the patient looks, how the patient feels, either the patient is well or sick, is he comfortable in the bed, does he appears in distress, or is he alert or groggy, does he look accurately or chronically, does the patient appear clean, is her or his hair is combed, does she bite her nails, etc. In the physical examination, in the leg, we go for the lymphadenopathy, lymph nodes enlargement, if it is there, no. Then thyroid, trachea, carotid pulse, etc. are checked. In the physical examination, go for the pulse examination, blood pressure, heart rate, respiratory rate, and the pulse oximetry. Then the mouth odor, eyes color, diagnosis, hair. Physical examination for chest, inspect wall, feel expansion, palpate apex, percuse lungs, osculate heart sounds. Safety precaution, hand washing before and after each patient connect, before and after each procedure. Wear gloves if there is probability of contact with blood, body fluids, non-intact skin, moist surfaces. Communication skills is very important. Segment into it, use regional language or vernacular language. 80% of diagnosis is made on the basis of history alone. So you should be very good enough, like Rajat Sharma in India TV. So he get answers from the peoples in Aapki Adalat very frequently. So you should be very good enough in concentrating the information extraction from the patient. So examination from head to toe, examination table, torch, light, any kind of small instruments for checking it, like BP apparatus, stethoscope, sphygmomanometer, torch, then stethoscope, etc. should be made up. In inspection, first see the patients when they leave. Systemic part of each component of each ROS, probably the sixth sense you have, which you can see as a clinician or examiner. Palpation. Palpation is to feel your temperature, dorsum of hand, position and consistency. Vibrating sense, tactile sense must be used. In general appearance, state of consciousness, signs of distress, stress, grooming, personal hygiene, facial expression, gait, posture, motor activity, skin, etc., discoloration. Special methods of palpation: light palpation up to 1 centimeter, deep palpation up to 4 centimeter, battlement and fluid wave. Deep sleeping palpation: examiner use forefinger, middle finger, ring finger that are tied together, slowing gradually palpate abdominal organs, masses slim down right, left, and right side. So this is frequently used for examining the deep mass of abdomen or GI lessons. So deep palpation, particularly we need to see that in deep palpation, deep mass. Bimanual palpation, intuit, liver, spleen, kidney. Deep press palpation, tenderness point. I'm understanding that on light palpation, the examiner tests for palpable mass, rigidity, pain. On deep palpation, examiner is looking after organomegaly, any kind of enlargement of spleen. The two-handed method may be used, meaning at the light lower quadrant, and examine the entire abdomen gentle by the deep palpation. Then comes up the deep press palpation, tenderness. For edema, then bimanual palpation, use both hands and into it abdomen, inspect, palpate, percuse, osculate, groins, legs, neurological examination portion is checked up. Where we see up for the temperature rise, for pyrexia is the term used for the temperature medically, increase slightly, and the third one is critical, which is a sharp or gradual temperature drop. So oral temperature 98.6, axillary with a glass or electronic thermometer, rectal 99.6, oral 99.6 must be there. Then some false measurement due to the smoking, hot, cold, liquid, rapid respiratory rate, failure to use thermometer correctly. Every disease have a symptoms like diabetes, polyuria, polyphagia, diphtheria, shortness of breath, apnea, edema, dizziness, cough, vomiting, fever, hemorrhage, headache, etc. are some other examples. So vomiting, nausea determine whether the patient is having the evidence with the thing. So you need to see the checklist, like blood pressure, systolic, diastolic levels can be checked for comorbidities like diabetes, ophthalmoscope, lenses and mirrors like -22 plus 40 diopters, light source, various apparatus like apertures like small pupils, red free filter, green beam, optic disc, pallor, minute vessel changes, right anterior eye, elevation of lesions, grid, size of under lesions. So this is how from ophthalmoscope the things look like. And particularly when you go for the medication history, you should have the form, you should go to the patient, you should do the ward round, you should have some complementary alternative medicines, ADR grading, allergens, various antibody, antigen mechanisms inhibited, allergies, types of allergies related to the patient, within the patient, pet allergy, dust mist allergy, any pollen grain allergy, hay fever, asthma, respiratory condition, mold allergy, vaccine allergy, drug allergy, sun allergy, food allergy, chemical allergy, virus allergy. Then complementary alternative medicines, aromatherapy, Ayurveda, yoga, acupuncture, diet therapy, massage therapy, chromotherapy, meditation, herbal medicine, homeopathy, hypnosis. Interventions and therapy, validation, communication therapy, reality orientation, remnants, music, aroma, diversion therapy. Then psychotherapy, hypnosis, feedback, family psychotherapy, group psychotherapy, physical therapy, exercises, occupational acupuncture. So there are some pharmacological and non-pharmacological therapy going on. That is why we have to do the medication chart review or medication history interview. So behavioral changes, reality orientation, validation therapy, remnants therapy, alternative art, music, activity therapy, complementary, bright light therapy, multisensory approaches, neuromics are some parts. So in this concentrated level, when you go for various kind of systems of medicines, polypharmacy occurs. Ayurvedic, Unani Siddha, homeopathic, online pharmacy, some other medicine systems. So this is why the medication history interview is required. required. So it is done for both kind of cases, either it is a Schedule H drugs or OTC drugs, whether it is a pharmacological category or non-pharmacological category. So interviewing a patient is very important part called medication history interview, where you go with the prescription errors, drug-related problems, adverse drug reactions, drug-food interactions, etc. So you have a patient profile form called medication profile. You look for ADRs, you look for allergies, you look for the dosage regimens, you look for the continuing care, you look for the drug stop orders. So why it is done? To check out DRPs, medication compliance, rational drug use, evidence of drug abuse, drug administration techniques, examine the needs of medication aids, document patient-initiated medication administration, importance of accurate drug history. Yes, then a good medication history should encompass all currently and recently prescribed drugs, previous adverse drug reactions, full medication history. Full data has to be obtained. In the medication history, you go with the first to last part, vital general systemic examination. This is vital, this is general, and you go with the history of present illness, then general examinations, instruments, exposures, demographic, age, date of birth, height, weight, race, ethnic origin, type of residence, education, occupation. So demography is very important thing, a personal information about the patient. Dietary supplements, dietary informations, veg diet or mixed diet. So dietary supplementations, foods, stimulants or suppressants. Then the next things which comes up is social habits. So in social habits, particularly tobacco use, alcohol use or illicit drug use is very important. So if they are using this anti-social activities as a food or habits, it should be stopped. Current prescription medications, name, dose schedule, reason for taking the medication, starting date, outcome of the therapy. Past prescription medications, name, description, dose schedule, reason, start date, stop days, reason for stopping, outcome of therapy. Current non-prescription medications, so-called as over-the-counter drugs, they are everything, dose, name, dose, reason, indication for taking, start, dose, outcome of therapy. Past non-prescription OTC drugs, dose schedule, reason, start date, stop days, name, reason, outcome. Current complementary alternative medicine, CAM, name, dose schedule, reason, start, outcome. Same way, allergy, drug name, description, dose, date, time of the administration of the anti-allergics is very important. Clinical, description of reaction, treatment of the reaction. ADRs, its causality and the chronicity. So description of the event, ADR reporting. National immunization scheme or universal immunization schemes, vaccinations and boosters, and what date it is started and closed. Past medication history forms are there where you have the patient demographic, date of birth, vitals, height, weight, date, current prescription medications, past prescription, current non-prescription medications, past non-prescription medications, current complementary and alternative medicines, past CAM, immunizations, allergies, adverse drug reactions, social history, dietary informations, assessment of patient compliance, etc. So you have to make a cards for the patient medication history interview scripts like allergy, prescription medication, H1 or H, non-prescription OTC, herbal, herbovigilance, herbal supplements, vitamins. Then additional, if you are using any eye drops, insulin use or metadose inhaler, nose sprays, any creams, lotions, to look after the things. And you have to tell about the patient, ask about the patient, H drugs, P drugs, OTC drugs, vaccinations, alternative or traditional remedies, description of reactions, medicines found to be ineffective, adherence to past treatment and use of adherence aids, various information sources like patient, family or caregiver, medication vials, bubble packs, medication list, community pharmacy, drug programs, information networks. And you have to ask several questions like, what are you taking medicines? Which community pharmacy do you use? Any allergy to medications or what was the reaction? Which medications are you currently taking? The name of medication, the doses form, the amount, how are you taking it, how many times a day, for what reason you are taking, what are the prescription medications are you taking on a regular basis, or what are the requirement of taking that medications, are you using any any herbal drugs, so it leads to polypharmacy, any supplements, vitamin supplements, any new medicines or any change in doctor, any drug stop order, any medications cause serious adverse effects or side effects, any drug stopped, any medicine you have stopped whenever you are feeling better, etc. Or you have started new medications if you feel worse. Then you do the patient counseling. In the patient counseling, you make for patient compliance, where you do pre-counseling, session counseling, opening, closing, and knowing the patient, counseling content. You are preparing patient information leaflet, reviewing the patient history, patient allergies, and patient counseling. There should be a specific area, highly confidential, and noise pollution free, and in that area the patient can talk up vocally with the disease matter and tell about the open-ended questions, close-ended questions, and very key points, and the outcomes can be there. So these are the short, long, and very long questions. What do you mean by medication history? What are the goal of medication history interview? What are the format standardized for patient medication history interview? You want to explain detail about medication history interview script. Add a note on data to be obtained in patient medication history interview. So thank you so much everyone for your patience listening. And if certainly we have any questions, I would like to ask our team. So from B.Pharm again we have question. Sir, if any patient non-cooperative, suppose children's or psychiatric patients, so in that examination, how we can perform? So in that case, I would like to tell you if the patient is pediatric or psycho condition. In that condition, particularly, you need to understand that that small kid has not to be counseled. We have to counsel his or her mother. And particularly in case of psycho, again, the patient assistant or relative, brother, mother, father, sister, anyone who's available, you have to do that one. So non-cooperative patients, or there's some renally or hepatic impairment problem, in that case particularly you have to take care of the patient. So concentrated level, I would like to tell you that this is one thing where you can understand that how to do the things, but it's okay to counsel such kind of patients. Any other questions? Confirmed by Dr. Abhishek, there is no such questions. So thank you so much everyone for joining, and once again welcome to ISF College of Pharmacy in Pharmacovigilance Week. You can join online on the platform. So thank you so much.